So I'm here with Carolyn, and one of the things Carolyn was just relating to me is that the upper back is an area that's really been bothering you, right?
Yes.
Yeah. We've done films on her, and we've had even a follow-up set of films, and we're working on restoring her cervical curve. We're also working on keeping her upper back in alignment. And since she was last here, which was about a month ago, right?
Yes.
She's had some adjustments that have helped her. Also, some of the adjustments may have caused some muscle firing to change a little bit. And so what we're doing here is very specifically going to work on her upper back muscles, her trapezius, and then we're going to give a specific scientific chiropractic adjustment, and then we're going to set her up on traction, and we're going to do some arthrostim and do what's called mirror image adjusting. And so all of this in an effort to help reacclimate her spine where it's supposed to be. I just want to show you something though. So when I sit here with Carolyn, her musculature that we tested from yesterday, everything was holding but one area. So we're going to go palms up. And when we went to the right like that, her mid-scalenes push down. Her anterior and medial scalenes are not firing. And when I come over here to her upper back, you can see she has the flattening of the upper back right there. So we're going to hold right here in her trapezius where it attaches to the spine. Push down, push, push, push. And her scalenes strengthen. And what that tells us is that there's an involvement here with her upper trapezius. The body is like an electrical circuit. And if we touch an area, there's receptors in the skin, there's receptors in the muscle, there are receptors in the joint. And if it turns on an area that was previously weak, we know there's an involvement there. And that's called therapy localization. We use that as an indicator. So what I'm going to do is have you lay face down now, please. And this is what we would consider an advanced muscle rehab, where we're going into her middle towards upper trap. Does not feel that great, but she's a trooper, and the result is oftentimes very powerful. So we're going to get this muscle to fire again. Breathe nice and deep. And out. This is the upper trap and rhomboid where it attaches here to the spine and vertebrae. Now what we're going to do is take her trapezius and rhomboid and do the counter strain, shoulders relaxed. Breathe in, all the way out. Stop breathing. So we're holding the muscle in a shortened position, breathing relaxed, while she's holding her breath. Give the traps a squeeze, released an adhesion, a soft tissue adhesion between the clavicle and the trapezius. Now we're going to lay face up, please. Gotcha. We're going to, as we did yesterday, we're going to have you just cover the chest here, and then hold, thank you, and then we're going to stretch out the pec just a bit. And again, all of this is done in a comprehensive fashion. Are you okay on the back here?
Yeah.
Yep. Because we're making an effort to change her spine and her muscle firing pattern.
Oh, I can feel it pulling through my armpit.
Yep, in a relatively short amount of time. So we're going to lay face down again. We're going to adjust her upper back. Okay, I want you to just acclimate yourself to this level of pressure. And we're going to breathe in nice and deep. And out. And when we deliver a specific adjustment, a lot of docs will come over and just push on the spine. What we're going to do is really take a very specific contact that we've mapped out on an x-ray. Breathe in and out. And there's a thrust and there's a torque with that. Breathe in again and out. And the result is a very specific adjustment to the upper thoracic vertebrae. And then once we do that specific work, then we're going to use the arthrostim and put her on traction, get the spine back in alignment. Thanks for watching.